Well, time now for a look at your health. 263 out of the 365 days of the year here in San Diego, we have sunshine, and it shows. More and more people are getting skin cancer, and particularly it's on the rise in teens, especially melanoma. Dr. Sabrina Fabi is here to talk about why this is happening and the warnings we all need to know about. Thank you for being here.
Thank you for having me.
During the commercial break, you were throwing out some statistics that shocked me. How many teens are getting skin cancer?
So in a national survey that was conducted, 40% of teenagers admitted to frequenting some type of tanning bed 10 times a year. And 15.6% of teenagers have gone to a tanning bed at least once.
And once you do that, how soon or how late does it start to rear its head in terms of cancers or things showing up in your skin?
Well, we're finally starting to see these numbers because it's become the #1 form of cancer, period, in those ages 25 to 29. So you figure this age group was being targeted 10 years ago and probably experienced a lot of tanning bed use in these last 10 years. And so finally we're putting in regulations and restrictions on tanning beds, especially in minors, because now it's become the second form of cancer in the ages between 25 and 29.
And we should point out that California bans it for minors, but also it's not just tanning beds, it's the sun as well. So, yes. But certainly let's talk about the fact that people don't seem to be heeding the warnings. Why do you suppose that is?
I think it's because of cumulative exposure that ultimately puts you at risk. And so people think that they're exempt from this, but what we have to remember is that, and unfortunately the American Cancer Society doesn't have any type of regulation on when you should be seeing a dermatologist. If it's annually, if it's biannually, exactly. There is no type of recommendations in place, unfortunately.
And you think there should be?
And I think there should be. And so presently what we're relying on are the A, B, C, D, and E's.
Let's go over that because that's an easy way to remember what some of the signs are for cancer. We actually have a graphic that shows it. Now, in self-examination, you say that's the key to detecting skin cancer.
Right. So A being asymmetry. So if one side of the mole is slightly asymmetric to the other side of the mole. Border irregularity, you want to make sure that the borders are nice, clear, not jagged or blurry. Color, homogeneity, you want the color to be the same throughout the entire mole. If it's a little darker on one side versus another, this is a sign of, particularly abnormal mole possibly. Although skin cancers can be less than 6 millimeters in diameter, D stands for diameter of greater than 6, you may want to see someone for concern. And then the most sensitive marker for an abnormal mole is E, evolving. Anything that has changed is something that should make you want to go see a dermatologist.
And is it not just moles, is it freckles too? Is it red discoloration, or is it always starting from that point? Is that ground zero for cancer?
You're right. A lot of skin cancers can just present de novo, we call it, without any lesion being present, but some can arise from a previous mole, even things that patients have been born with and have always had. I think that's a common misconception, that patients believe that because they've always had it, it's benign. In fact, they can also develop melanomas within what we call congenital moles, moles that they've had since birth.
All right, so how often should we see the dermatologist and how soon should we have our teams see them?
I like to have my patients come in and see me yearly for a skin cancer exam. Obviously, if they've already had some type of skin cancer in their life, they should be coming to see me at least twice a year if it's a non-melanoma skin cancer, and even 4 times a year initially if they've been diagnosed with a melanoma. And patients who have a family history of melanoma need to come in sooner. They definitely need to be coming yearly. But most importantly, if you have anything that's changing or that falls within the A, B, C, and D, and E's, patients need to come in.
All right, Dr. Sabrina Fabi, thank you for being here.
Thank you for having me, Kathleen.
All right, a very important reminder, even though it's a cloudy day, Walter, we do get all of that sunshine.
Yeah, some great information. Thank you.